Hi friends, good evening. Once again welcome back to my channel Mugambika Nursing. Friends, in the previous video we discussed one set of previous year questions and answers and completed 60 questions and continuing the questions, and today we can see from question number 61. Question: the extracellular fluid includes the following except. Options: Option A, synovial fluid, pericardial fluid and pleural fluid. Option B, cerebrospinal fluid and fluid in the interstitial spaces. Option C, fluid within the cells. Option D, blood, plasma and lymph. Our question: among this, which one is not an extracellular fluid? And the correct answer is, it is option C, fluid within the cells. Remaining all are extracellular fluids. And the next question, question number 62. The nurse is assigned to a patient who has a bacterial pneumonia and is under droplet precautions. Which personal protective equipment will she wear to deliver the meal tray? Options: Option A, only mask is needed. Option B, gown, mask, gloves, shoe covers. Option C, no personal protective equipment required. Option D, special filtration mask and gloves. Here the question: a patient with bacterial pneumonia is under droplet precaution or isolation. Which personal protective equipment should the nurse wear while giving meal tray or while giving food to the patient? And the correct answer is, only she wear mask. Only option A is the correct answer. Only mask is needed. Move on to the next question. Wearing seat belt, safety helmets and other safety equipments are example for. Options: Option A, holistic healthcare model. Option B, tertiary health promotion behavior. Option C, primary health promotion behavior. Option C, secondary health promotion behavior. Safety precautions are coming under primary health promotion behavior. Option C is the correct answer. And the next question, question number 64. Why it is important for healthcare providers to monitor the growth and development of the children? Our options: Option A, early detection of potential problems leads to earlier care and treatment. Option B, parents need the reassurance of professional to know their children are healthy. Option C, statistical analysis is important for research. Option D, studying groups of children helps to determine normal ranges. The question is, why it is important to monitor the growth and development of the children? It helps to early detection of potential problems, leads to earlier care and treatment. Option A is the correct answer. And the next question, question number 65. Which of the following is the most abundant type of blood cells? Options: Option A, lymphocyte. Option B, erythrocyte. Option C, monocyte. Option D, thrombocyte. Among this, which is the most abundant blood cells? It is erythrocyte. Option B is the correct answer. And the next question, question number 66. Compression of facial nerves in the temporal bone will leads to. Options: Option A, multiple sclerosis. Option B, meningocele. Option C, Bell's palsy. Option D, Guillain-Barré syndrome. Compression of the facial nerves cause Bell's palsy. Option C is the correct answer. And the next question, question number 67. Rh negative mother should receive globulin. Options: Option A, acetylcholinesterase. Option B, RHOM globulin. Option C, lecithin sphingomyelin. Option D, RHOD immune. Rh negative mother should receive RHD immune. Option D is the correct answer. Move on to the next question, question number 68. Reye syndrome is associated with. Options: Option A, hemolytic transfusion reaction. Option B, biliary colic. Option C, sickle cell crisis. Option D, use of aspirin with viral illness. Reye syndrome is associated with aspirin. Okay, so the correct answer will come use of aspirin with viral illness. Option D is the correct answer. And the next question, question number 69. The bacteria that retain the stain in Gram method of staining is a. Options: Option A, Gram negative bacteria. Option B, spores of bacteria. Option D, broad spectrum bacteria. Option D, Gram positive bacteria. Our question is, which type of bacteria is retained in the stain in Gram method of staining? It is Gram positive bacteria. Option D is the correct answer. The next question number 70. The following are presenting symptoms of patient with catatonic schizophrenia except options. Option A, have dangerous periods of agitation and explosive behavior. Option B, disorganized behavior and speech. Option C, sudden onset of mutism. Option D, stereotyped position with waxy flexibility. Our question is, which one of the following symptom is not present in case of catatonic schizophrenia? And it is disorganized behavior with speech. Option B is the correct answer. And the next question number 71. The key dietary advice given for patient with gastroesophageal reflux disease is options. Option A, high fiber diet with lots of fluids. Option B, to avoid protein and calcium. Option C, to take high carbohydrate diet. And option D, to avoid caffeine, tobacco, beer, milk and carbonated beverages. Our question is, which dietary advice will give a patient with GERD or gastroesophageal reflux disease? Should avoid caffeine, tobacco, beer, milk and carbonated beverages. Option D is the correct answer. And the next question number 72. The key instruction to be given to the patient and the caregiver with epilepsy is as follows except options. Option A, take medications daily. Option B, take showers in bathtubs. Option C, avoid alcohol, smoking, hypoglycemia. Option D, maintain medication and seizure charge. Question is, the key or the important instruction given to a patient and caregiver of epilepsy except, which is not included in the instruction. It is option B, take showers in bathtub. They should not take showers or bath in bathtub. Option B is the correct answer. Question number 73. The size of which part of the eye contributes to the controlling the amount of light entering the eye? Our options. Option A, lens. Option B, optic disc. Option C, macula lutea. Option D, pupil. And the correct answer is, it is pupil. Option D is the correct answer. And the next question number 74. Phototherapy is indicated for children with options. Option A, necrotizing enterocolitis. Option B, hyperbilirubinemia. Option C, hemolytic disease. Option D, hypoglycemia. Indication of phototherapy is hyperbilirubinemia or increased serum bilirubin level. Option B is the correct answer. And the next question number 75. The following are the important pre-operative nursing care for a patient with benign prostatic hypertrophy except options. Option A, promoting urinary drainage. Option B, assure nutrition and correct fluid and electrolyte balance. Option C, hormonal therapy. Option D, acid-ash diet to treat infection. Our question is, which one is not an important pre-operative nursing care for a patient with benign prostatic hypertrophy or BPH except is the question. Okay, so correct answer is option C, hormonal therapy. Remaining promoting urinary drainage, nutritional support and acid-ash diet to treat infection, all are we will give preoperatively to BPH patient, but hormonal therapy is not an important operative nursing care. And the next question number 76. Gestational diabetes increases risk for the following except options. Option A, small for dead fetus. Option B, prematurity and stillbirth. Option C, macrosomia. Option D, congenital anomalies. Here also question is except gestational diabetes increase the risk for the following except it is small for dead fetus. Option A is the correct answer. And the next question number 77. Artificially acquired immunity is obtained by options. Option A, immunization with antibody response. Option B, being breastfeed. Option C, exposure to a disease. Option D, recovering from a disease. Artificially acquired immunity is obtained by immunization with antibody response. Option A is the correct answer. And the next question number 78. The major determinants of health. Options. Option A, public education and information. Option B, public work, water, sanitation and housing. Option C, screening of diseases. Option C, agriculture, food and nutrition. The major determinants of health is screening for diseases. Option C is the correct answer. And the next question number 79. When assessing physical development of the 5-year-old, you would find it abnormal if he. Options: could jump. Option A, could jump on one foot a few times. Option B, could catch a large rubber ball. Option C, needed to go up a stairway one step at a time. Option D, could stack up pile of 6 blocks. Here the question is, while assessing the physical development of a 5-year-old child, which one is abnormal if it is noted? Okay, so the correct answer is option C, needed to go up a stair one step at a time. If he is not doing that, it is abnormal. Option C is the correct answer. And the next question number 80. The most significant characteristics experienced by a patient with depression is. Options: option A, hypervigilance and nightmares. Option B, aggressive, abusive or violent behavior. Option C, lack of impulse control. Option D, depressed mood and loss of pleasure or interest. Our question is, which is the most significant or most important characteristics of a patient with depression? And it is depressed mood and loss of pleasure or interest. Option D is the correct answer. And the next question number 81. False labor manifestations are as follows except. Options: option A, contractions irregular. Option B, abdominal discomfort. Option C, contraction lessen with activity or rest. Option D, cervix progressively effaced and dilated. Our question is, which one is not a manifestation of false labor? And the correct answer is cervix is progressively effaced and dilated. Option D. It is one of the manifestation of true labor pain. And the next question number 82. The patient who has an appointment for a pap smear should have been instructed. Options: option A, not to douche or use vaginal medication before the test. Option B, that the procedure take about 45 minutes. Option C, that she will know the test result before leaving the office. Option D, to bring sanitary pad because moderate bleeding may occur. Pap smear is one of the screening tests for cervical cancer. It is a very simple procedure, so it will not take 45 minutes. So option B is wrong. And option D, the result will get after 3 to 5 days. And also no need to use sanitary pads. So the correct answer will come option A, not to douche or use vaginal medication before the test. Option A is the correct answer. Then only it will be accurate. Question number 83. All elderly tend to be more susceptible to infection because of. Options: option A, increased exposure of pathogens. Option B, pure nutritional status. Option C, a decline in immune function. Option D, lack of exercises. Elderly people or older people are more tend to be infected because decline in immune function. Option C is the correct answer. And the question number 84. Principles of ethical practices include the following except. Options: option A, justice. Option B, maleficences. Option C, beneficences. Option D, rest for autonomy. And the correct answer is option B, maleficence. And the next question number 85. In rheumatoid arthritis, during the acute phase, the value which are significant. Options: option A, LFT elevation. Option B, CBC elevation. Option C, RFT elevation. Option D, ESR and C, reactive protein elevation. In rheumatoid arthritis, there will be increased ESR and C, reactive protein. So option D is the correct answer. ESR and C, reactive protein elevation. And the next question number 86. Hoffman sign is used to assess. Options: option A, hematoma. Option B, wound sepsis. Option C, deep vein thrombosis. Option D, hypotension. Hoffman sign is used to assess deep vein thrombosis. Option C is the correct answer. And the next question number 87. The main clinical manifestations of pulmonary edema are as follows except. Options: option A, hypotension. Option B, cough with expectoration. Option C, dyspnea. Option D, cyanosis. Our question is, which one is not a main clinical manifestation of pulmonary edema? It is hypotension. Option A is the correct answer. And the next question number 88. The amount of air passing into and out of the lungs during each cycle of breathing is referred as. Options: option A tidal volume, option B total lung capacity, option C residual volume, option D vital capacity. Our question is the amount of air passing in and out of the lungs during each breathing is termed as tidal volume. Option A is the correct answer. And the next question number 89. The patient with appendicitis usually exhibit the following clinical manifestations. Options: option A, array-bound tenderness at the McBurney's point. Option B, pain occurs immediately after eating. Option C, hematemesis or melena. Option D, heartburn, regurgitation and dysphonia. The patient with appendicitis usually exhibit array-bound tenderness at the McBurney's point. Option A is the correct answer. And the next question number 90. In Erik Erikson theory, adolescent development essence of. Options: option A identity, option B intellect, option C initiative, option D industry. It is a direct question and the correct answer is it is identity. Option A is the correct answer. Question number 91. To encourage an infant's cognitive and psychosocial development, parents and other caregivers should. Options: keep the baby with them at all times so he or she is safe. Option B, allow the baby to play alone several hours each day. And option C, give loving, consistent care including playing. Option D, family explain the rules of acceptable behavior. For an infant cognitive and psychosocial development, parents and the caregiver should give loving, consistent care including playing. Option C is the correct answer. And the next question number 92. Bipolar disorders are treated with the following medications except. Options: option A, amphetamine, option B, lithium, option C, carbamazepine, option D, valproic acid. And the correct answer is it is amphetamine. So option A is the correct answer. Remaining all medications are used for the treatment of bipolar disorder. Question number 93. Responses to avoiding therapeutic communications are as follows except. Options: option A, closed-ended questions, option B, arguing and judgmental responses, option C, advice giving, option D, reflecting and clarifying. Here also except is the question. So which one is not a response to avoiding therapeutic communication? And the correct answer is option D, reflecting and clarifying. Option D is the correct answer. And the next question number 94. The three-tier features of a community. Options: option A, agent, host, environment, option B, location, population, social system, option C, physical, mental and social, option D, primary, secondary and tertiary. The three-tier features of a community is location, population and social system. Option B is the correct answer. And the next question number 95. The traditional source-oriented narrative type of charting is characterized by all of the following forms except. Options: option A, laboratory sheet, option B, doctor's progress sheet, option C, diabetes form, option D, history and physical examination form. And the correct answer is it is laboratory sheet or lab form. And the next question is the cleft palate usually repaired. Options: option A, 12 to 18 months, option B, 6 months, option C, 2 to 3 months, option D, 3 months. Cleft palate surgery is usually performed between 12 to 18 months of age. Option A is the correct answer. And the next question number 97. The major nutrients involved in fluid balance are. Options: option A, chloride and carbohydrate, option B, potassium and sodium, option C, fats and proteins, option D, vitamin B9 and magnesium. The major nutrients involved in fluid balance are potassium and sodium. Option B is the correct answer. And the next question number 98. The cerebrospinal fluid is secreted by. Options: option A, choroid plexus, option B, pons, option C, arachnoid villi, option D, central sulcus. CSF is secreted by choroid plexus. Option A is the correct answer. And the next question, question number 99. Medical asepsis differ from surgical asepsis in that it is aimed at options. Option A, preventing entry of microorganism into the body. Option B, sterilizing all equipments. Option C, preventing transmission of microorganisms. Option D, killing of all microorganisms. Question is, medical asepsis differ from surgical asepsis that mainly it aims to preventing transmission of microorganism. Option C is the correct answer. And the next question, it is the last question. Preterm labor is when it occurs between options. Option A, 16 to 20 weeks of gestation. Option B, 24 to 30 weeks of gestation. Option C, 20 to 37 weeks of gestation. Option D, 32 to 36 weeks of gestation. Preterm labor means it occurs between 20 to 37 weeks of gestation. Option C is the correct answer. So here we completed another one set of questions, previous year questions and answers. Surely these questions will guide you for the exam preparation. If it is useful for your studies, please share these questions to your friend circle.